Hello, and welcome once again to the Dental Marketing Mastery Series. This podcast is brought to you by dentalwebcontent.com and New Patients Incorporated. I'm Howie Horrocks, the founder of New Patients Incorporated. Along with me once again is my friend and partner and the president of New Patients Incorporated, Mark Dilatush.
I get the pleasure of interviewing Julie Mitchell today. Julie is a fellow with ADOM, and she's also happens to be the product manager for Dental Web Content, which is our new online media center of tested effective dental advertising content. Welcome to the podcast or the interview, Julie. How are you today?
I'm good. Thank you for having me.
Good. Well, the topic of today's discussion is going to be specialists and how specialists gift or reward their GP referrals. And you were an office manager for how many years?
Just about 20.
20. Okay, so in 20 years of being an office manager in a GP office, how many cookie baskets, how many pickle jars, and ridiculous baskets of goodies did you receive from all the people that your GP referred to?
Too many.
Too many. Okay. And you and I both know many specialists. And we know many office managers from specialist offices. And their number one complaint after they give those gifts would be
that the GPs don't view them as rewards for referrals.
Right. So they kind of look at him like, oh, good, another basket. This one's green. The last one was brown. The next one will be blue, whatever. Right? Okay, so it became kind of an entitlement rather than a gift for a referral or a reward, right?
Absolutely, yes. It was not a gift or reward for referrals. It was expected.
Right. So there's the specialist, the periodontist, the endodontist, or oral surgeon, or whatever specialist. They're sitting out shelling out $150, $200, $400 for these baskets for each one of their GPs that are, the good referring GPs. And on the other end, the GPs are going, cool, another brown basket, another green basket, another red basket, another basket. It's only Tuesday. Let's get to work. So they don't even really they don't even value them. They just, they eat what they like and they give the rest of their staff probably, right?
Actually, usually the GPs don't even get to it. The staff gets to it.
Right. Okay. Yeah. All right. So it's not that this is a problem. It's not a problem. It's just an age-old exercise that general dentists and specialist dentists have been playing for. I've been in dentistry for 27 years. They've been playing it for at least 27 years because none of it's changed, right? So along comes this product called Dental Web Content. Now, if you're a specialist listening to this, and we hope you are, Dental Web Content is an electronic online library or media center filled with proven effective advertising content for every conceivable dental service, convenience, technology, public relations asset in every conceivable media type. Online, offline, web pages, social media posts, social media ads, PPC ads, every form of mail, postcards, trifold, everything you could possibly imagine is in this portal. And general dentists subscribe to this portal. And they pull effective advertising content and they use it to promote their practices, which in turn generates business for you. So here's our proposal to you, the specialist. the subscriptions are very, very affordable. They're monthly subscriptions. They range anywhere from $67 to $147. So our proposal to you, Dr. Specialist, is to consider using the same money you're using on cookies and wine and Lord knows whatever else you've ever sent over to that GP's office. Use the same money you're spending there to give them the benefit of great advertising content, which ends up giving you more new business. Now, when was the last time you spent your referral reward dollars on something that actually brought you more business? That's the question we would ask, and that's what DWC does. You are actually giving the gift that keeps. Remember that old. What was that old saying, Julie? Is it give the gift that keeps on giving, like the Jelly Club or the Pickle Club or whatever, right, from the old days? Well, this is
once a month club.
Yeah. This is truly, this is truly the gift that actually gives you back. You actually get your money back and then some. If you sign up your GPs, they will use advertising content that actually has been tested. That will be more effective, and it will return the dollars to you. Yes, Julie.
The content of DWC will help the GPs drive new patients to their practice, but also will help to reactivate some of their older patients, people that they've lost track of, we've fallen through the cracks. With that building up of the GP practice, it only goes to reason that the more business that the GP has, the more business he's going to have to refer to his specialist, the endodontist, the periodontist, the oral surgeon, what have you.
Yeah.
So it is the gift that keeps on giving.
Yeah. How much content I can't possibly ask you this question because I know you don't know the answer, but the number's large. How much content's in DWC on emergency treatment, on periodontal disease, on dental implants, on implant-supported dentures? It's nearly endless, right? So, and how much content is in DWC, which we identify as internal promotion, where the GP on a regular basis educates his or her patients on the additional breadth and scope of treatment that they offer. In other words, most patients don't know that their dentist offers X. Most patients only know what that dentist has done specifically to them. So continually educating their own patient base, even if they only use dental web content for that, it's still going to bring the investment back, and certainly better than a box of cookies.
Because when a GP is marketing just to his established patient base and informing his regular patients of what he has, what services he offers, and educates those patients, it's going to bring those patients are going to want more services. The more services they want, the more of their friends and family they bring in. Again, it just drives more production, more business to the GP, which in turn drives more business to the specialist. So it's a win-win situation all the way around for the office manager, the GP, and for the specialist.
So there you go, specialists out there. And actually, if I have GPs listening, go tap your buddy specialist on the shoulder and ask him to subscribe for you. You could always do that. You could do that over dinner, right? But
over dinner.
Right. For the specialist out there, consider it. Consider, you're not spending new money. You're just spending the same money you were spending. Consider shifting that over from food items or, the basket items. I'll just call it basket items. Shift that money over from the basket items to something that both of you would prosper from. And that would be a subscription to dental web content. So, Julie, thanks for your time today. I know you have lots of content to load into DWC before we go live. We'll be going live to the general public on June 22nd. VIP week starts June 14th. VIP week is where you get preferred pricing for life. So, Julie, how would they, you know what? Let's leave them with an email in case they want VIP pricing. Why don't you send an email to Josh, Josh, at newpatientsinc.com, and Josh will get you hooked up with VIP pricing. Thanks for your time, and let's go back to work.
Okay, thank you.
All right.
We hope you've enjoyed our podcast today. You can find more podcasts on our YouTube channel, on Stitcher, and iTunes. Also on our websites dentalwebcontent.com and newpatientsinc.com.